What would be like the early signs for Lewy body disease, or what are the signs that people are looking for?
So certainly cognitive changes, and they're distinct from what we see in Alzheimer's disease. So less short-term memory and more being able to follow recipes, being able to navigate environments, and then hallucinations or other types of symptoms related to this. It can be delusions or illusions, so mistaking shadows for bugs, for example, and that shortly thereafter or simultaneously you can develop changes in your function, your motor function, how you move. Those should raise concern for dementia with Lewy bodies. And again, it's important. Folks, I frequently get the question asked if it's related to Parkinson's disease. In fact, when we look at the brain of a patient with Parkinson's disease and dementia with Lewy bodies, we see some of the same changes, right? There's a protein that's normally present in our brains that adopts a different fold, gets deposited into specific areas of the brain, and it impacts their functioning. Why is then such a lot of effort goes into distinguishing these conditions? And part of it is understanding that the medications that we treat symptoms of patients with Parkinson's disease may not work as well in folks who have dementia with Lewy bodies. There are symptoms, for example, that we rely on if there is component of hallucinations, low-dose antipsychotics medications, for example, that folks with dementia with Lewy bodies may be a little bit more sensitive to the side effects. There are also prognostic implications. So the rate of decline of somebody who has dementia with Lewy bodies can be more rapid than what we see, even with patients with Alzheimer's disease.
Mm-hmm.